I just want to thank you for having Abbott today and thank everyone for joining this morning. This is such an important summit for us to talk about shared value and purposeful business. Abbott has been a member of the Shared Value Initiative since 2015, and we are pleased to be joining the Shared Value Africa team for this important dialogue and to be the sponsor for today's session, Transforming Healthcare in Africa. I just want to start off with a little background about Abbott. For those of you who are not familiar with our company, I can have the first slide. We are a diversified healthcare company based in the US, and our goal is to deliver transformative technologies in the areas of diagnostics, nutrition, branded generics, and devices. Our purpose is to help people live their best lives. And we do that through partnerships, through shared value, and through global business. And as you see at a glance, we have 107,000 people around the world. We've been in business for 130 plus years in 160 countries. And you may be familiar with some of our products, Similac, Ensure, Pedialyte, Freestyle Libre, that helps people living with diabetes. Next slide. So a little bit more about our business. We provide healthcare solutions for every stage of life, and you'll see there's cardiovascular care, diabetes, diagnostics, neuromodulation, as well as nutrition and branded generic medicines, as I mentioned. So we really span every stage of life for everyone, and our goal is to transform the future of healthcare. So that's just a bit of background about Abbott. Thank you for the slides. The intersection of business and society and finding new ways to grow our business has long been a way of thinking at Abbott. We've raised the bar in recent years by developing intentional targeted programs that deliver sustainable and transformative models. We began our shared value journey with the FSG and Shared Value Initiative team, as I mentioned, back in 2015 with our first shared value program in India. And we partnered with the government there to help localize the dairy supply chain for one of our top nutritional products. And since then, shared value has really become an integral part of the way we think about business at Abbott, including our response to one of the greatest challenges I think we're all facing, the COVID-19 pandemic. While this virus has created some new and unexpected issues, it's also magnifying many of the challenges that we've all been discussing for years around healthcare, the health ecosystem, including issues and gaps here in Africa. Later today, a panel will dig deeper into COVID-19 and how organizations across the continent, including Abbott, are driving momentum towards testing and treatment and transforming healthcare in Africa. From Abbott's perspective, we're working to advance best-in-class diagnostics for COVID-19 around the world. This includes our M2000 system for molecular diagnostic testing, as well as our Architect system for antibody test. So both systems are used in labs in Africa, providing the top COVID-19 testing on the continent and around the world. And to help advance clinical care for COVID-19, we're supporting the work of the African Federation for Emergency Medicine, bringing COVID-19 technical guidance and training to acute care providers in 26 countries across the continent. The COVID-19 pandemic is undoubtedly shaping the healthcare landscape, but what's become most evident is there's greater need for cross-sector collaboration, and business has an important role to play in this effort. Cross-sector partnership has been key to Abbott's work in Africa for a long time. We've worked for decades on a number of collaborative initiatives to address societal challenges through business. And this starts with our product innovation. We're a science-based company, and we're working to transform the future of healthcare. And that means that we're creating technologies that are designed to meet specific health needs, including gaps in low resource settings. One example is over the last 2 decades, we've partnered with diverse organizations to improve diagnosis, enhance patient care and treatment for HIV/AIDS. Our HIV tests play an important role in advancing HIV testing across Africa. We've created localized innovations that have taken large diagnostic systems in core labs and reimagined those into small systems that fit on the back of a motorbike, providing the best treatment and care. We've also worked with governments across the continent One of our best efforts is with the government of Egypt. In 2018, we partnered on a mass screening campaign to detect and eliminate hepatitis C. So beyond supplying our rapid test, we work with the Ministry of Health in Egypt to develop a successful mass media campaign. We educated the public about testing, trained more than 7,000 healthcare workers, advised on supply chain management and logistics, and also worked to build an investment case for external funding, which is arguably one of the most important components of sustainability. The results had great impact. In 7 months, 60 million Egyptians were screened for hepatitis, saving more than 2 million lives. And right now we're working with other governments across the continent to scale and refine that model in many other countries. One of the initiatives, though, that I'm most proud of is our shared value program in Rwanda. It focuses on addressing access to quality healthcare in rural communities, one of the greatest barriers to great health. 60% of people in sub-Saharan Africa, including 83% of people in Rwanda, live in rural areas where access to quality care can be a challenge. Rwanda has been demonstrating exceptional leadership on expanding access to rural healthcare, as Rosemary mentioned. And at Abbott, we're honored to partner with the Ministry of Health and our NGO partner, Society for Family Health Rwanda, to help drive the minister's ambitious plan to decentralize care in the country, ensuring that all Rwandans have access to quality care within a 30-minute walk from their homes. This has been a very fascinating and fulfilling partnership for Abbott. We're building next generation health posts. We've co-created a model with the ministry with SFH, and we're bringing primary care testing and many other health services closer to home. And this is saving lives, and we're also monitoring and measuring how this saves healthcare costs in the country. In the process, we're also creating new markets for new products and including diagnostics and medical products. And a panel later today will dig into this model more, and you'll hear more about the vision for decentralized healthcare from the Honorable Minister during the next keynote. In closing, we want to thank the Shared Value Initiative for this important dialogue. This is a platform for what we believe is one of the most important conversations we can be having, the role of business in society and how to use shared value strategies to transform healthcare. We know that health systems are vital for sustainable development, and a healthy population is reliant on economies growing and thriving, new innovations, innovative thinking, and transformative care. Through cross-sector collaboration, we can catalyze progress towards the universal health coverage and the sustainable development goals. It will take partnership and an intentional business strategy to address social issues that are barriers to business transformation and business success. Thank you again for joining us today. I hope that you enjoy the conversation, the theme, Transforming Healthcare in Africa, and we appreciate you being part of this important dialogue. Thank you.